Hi, my name's Jenny Hopkins, and I'm the manager of the Med-Surg floors here at St. Luke's Magic Valley. Today I'm going to be taking you on a tour of where we're at with our patient rooms here in the Med-Surg areas and our overflow areas that we're utilizing as we've seen our patient population and our COVID numbers increase. One of our first overflow areas that we began to utilize was our inpatient rehab unit. They had the ability to take some of our less sick Med-Surg patients right off the bat. Their staff are used to caring for some of the same level of patients that we had, and so we started evaluating pretty quickly 1 to 2 patients a day to go over there to that rehab area. We're here on the general medical floor, which has really become our COVID overflow floor. So our 4th floor was originally where we were housing all of our COVID patients, but as our population with COVID has grown, we've had to overflow now to our medical floor, which at first was just a handful, but now we pretty much are all COVID on this floor. We had 26 beds as the general bed space for this medical floor, that we've had to increase our bed space to 36, which means that we've had to overtake the N10 rooms, which is generally our women's and children's area where all peds patients go. So we've had to move that population to a different area in the facility, and they're still able to take those patients in just a different area, and now we're occupying all 36 beds on this floor. And again, those are pretty much all COVID patients on this floor. We filled up those beds over the medical unit up to those 36 beds with the women's and children's area. We had to find another place to start putting patients because we had no other rooms in our regular inpatient side. So we've come over here to same day. So normally where patients come to have their same day surgery and go home that same day, that's what these rooms are originally designed for. We've converted 30 of those rooms into potential patient rooms and started flowing patients over here. So now we are in another overflow area, PACU B. So this would be where we would continue to use those 30 beds in the same day area. We started overflowing into this area. The patient experience is going to be very different because it's not going to be your traditional rooms where you're by yourself. There'll be curtains that are separating patients. So we were full over there. Then we would look to flow here to GI lab and start filling up this space. Now, should this space get filled up, we also have kind of our next contingency plan, and that would be looking at our ambulatory surgery center. Really providing care to our community is really our priority, and we want to be able to maintain that if we continue to see our COVID numbers go up.